Good morning, everyone. We're going to go ahead and get started. Thank you all so much for joining us today to hear about several important topics related to the work that we do collectively to support children and families in New Jersey. My name is Christine Norbert-Beyer, and I have had the privilege of serving as Commissioner of the Department of Children and Families since 2018. Joining me today are some of my colleagues and our partners from Advocates for Children of New Jersey. And I especially want to thank Mary Coogan and her team for being great collaborators in co-hosting these forums with us over the last 7 years, first in person and later in this virtual space. In addition to our DCF and ACNJ team members, we will also be hearing today from experts from outside of New Jersey who have a perspective on federal policy changes that affect the work we do here in New Jersey. In a moment, I'll go ahead and review the agenda for today's forum, but I wanted to begin with a reflection on our efforts to build and sustain a successful, systemic approach to supporting families in New Jersey. Throughout this administration, we've been able to conduct in-person and virtual meetups to keep our providers, stakeholders, and system partners informed of the latest practice developments, program offerings, challenges, and growth opportunities in New Jersey's child welfare system. I'm grateful for the chance to have such open and honest conversations with our system partners to share my vision, the department's vision for a safe, healthy, and connected New Jersey, and to work with all of you to see that vision move from a statement written on a dry erase board in my office 7 years ago to become a real attainable goal with measurable outcomes that we all strive to achieve every single day. I've said many times before that the work of supporting children, youth, and families in New Jersey is not the dominion or the provenance of one singular department or one administration. It takes all of us moving together over a sustained effort to achieve success. And in New Jersey, thanks to all of your efforts, thanks to the partnership and faith of policymakers and governors of both political parties, thanks to a dedicated and committed workforce at the department and in our provider agencies, we've been able to achieve some pretty significant successes. New Jersey has the lowest out-of-home placement rate in the country. We've able to support more families together rather than relying on the severe intervention of family separation as a primary safety intervention. We have among the lowest maltreatment and repeat maltreatment rates in the country. When there are serious safety considerations that warrant and justify an out-of-home placement, we rely more often on kinship placements to provide temporary, safe, and familiar shelter options for children in our care. Since 2021, more children have been placed with kin than in traditional or unfamiliar resource home placements. New Jersey has an expansive prevention infrastructure and has operated as an innovation lab for best and promising practices in the field of child welfare. And through the Federal Family First Act, we will soon be able to draw down additional federal support to continue to grow our prevention offerings. We've launched game-changing initiatives supporting the parents of newborns with a home visit from a credentialed and specially trained nurse. And we have developed programming to support students and their families in New Jersey schools and their communities. We have a robust continuum of youth mental health and mental health care. In this administration, we have made historic investments in the service available to families navigating the service continuum for their children with behavioral health challenges, substance use issues, or those who are living with intellectual and developmental disabilities. We have supported survivors of domestic violence and sexual assault to heal and find a path back to emotional and physical safety with a recent focus on housing first. We have expanded the state's awareness of positive and adverse childhood experiences and helped New Jersey communities grow in their resiliency. We have engaged individuals with lived experience as co-designers in the future of child welfare in our state. We've supported a workforce susceptible to vicarious and secondary trauma, and that they continue to show up for families, and we have showed up for them. And I'll admit, On our best days, this is not easy work. But over the last 7 years, we've done all of these things while contending with an environment of uncertainty. We've continued to offer support to families through a once in a century pandemic, right? You all remember that, even when we were struggling with our own family's safety and well-being. We've seen an epidemic of youth mental health concerns, which was growing in intensity before the pandemic, but was certainly exacerbated by COVID-19 and the ensuing feelings of isolation that gave rise to heightened anxiety and depression among our state's young people. We've experienced economic volatility on both the national and state levels that has increased the cost of living and the demand for material needs for the families we support. And we've been affected by increased partisanship, unfortunately, and the spillover of some heated rhetoric and conflict from two wars on the other side of the globe, but that have real implications for how we relate to our neighbors here in our state. Through all of these challenges, the people working in the child welfare system, whether at DCF or all of you in our provider agencies or any of our system partners, we all have continued to show up with grace and kindness, respect, collegiality. All of our workforce and all of you continued to support families through these very trying circumstances and continues to support one another. I'm so very proud of and thankful for the compassionate people who have dedicated their lives to public service and specifically in service to children and families within our state. Thank you for your ongoing partnership to help every New Jersey resident be safe, healthy, and connected. So with all of that, let's take a look at today's agenda. Following my opening remarks on this agenda, I'll provide an, sorry. So you will hear, I think after I do this introduction, I'll go ahead and provide an overview of the New Jersey FY26 budget and highlight the changes from the governor's proposed budget in February to the final budget that was adopted just on June 30th. After that, Mary Coogan will also provide opening remarks as she introduces Danielle Ewan, a policy and strategic consultant with Sixth Street Associates. That session will take place after a quick break. Immediately following my remarks, we'll hear from Kristen Matera in our Office of Grants, Proposal Management and Reporting, and Karen Baldoni from our Office of Contract Administration. She's our Director of Contracting, regarding some of the terms and conditions around federal grant awards and contracting considerations for our providers. And the information that Kristen and Karen will share mirrors some that we shared earlier this summer on a webinar, but we felt it was important enough to bring back that information to share it again. And so after the break, Mary will provide her remarks. She'll introduce Danielle, who is an advocate for early childhood education with the Alliance for Early Learning, to share some information on federal actions and their impact on early childhood programs. Next, we'll hear from John Sciamana, a senior policy consultant with the Child Welfare League of America, about the specific impacts on New Jersey related to the federal budget reconciliation process. And then we'll provide a quick wrap up. There will be time during today's forum after Kristen and Karen's presentation, Danielle's presentation, and John's presentation to pose questions, and Mary and I will moderate those. So if you have questions or you're thinking of something as you're hearing each of us speak, please enter your questions through the Q&A feature on today's Zoom webinar. That's where we'll pull our questions from. And then following today's meeting, we will share the materials and the video recording of the forum with all registered attendees and also on the DCF website. So now I will begin to at least walk you through the final New Jersey FY26 state budget. So as you recall, From the provider call that we held with many of you following the governor's budget address in February, and then my testimony to the New Jersey State Legislature in the spring, the fiscal year 2026 budget was initially shaping up to be a pretty difficult budget year. I had previously spoken about the perfect storm of reduced revenues collected through the state and the sunsetting of the federal COVID aid, which reflected a challenging situation for state government. So, heading into the development of the governor's proposed budget, departments were asked to reduce their spending by about 5%. And that's after discretionary legislative additions had already been removed from the base budget. So for DCF, much of our budget is tied to required spending, and we weren't able to consider those spending items in proposed budget cuts. As you can see from this table, we were looking at a proposed budget that reduced our direct state appropriation by about $46 million and estimated a reduction in allocations and fees, such as dedicated marriage licensing fees and divorce filing fees, which come to DCF, by $2 million. It's important to note that the allocations funding shown here doesn't account for a large portion of the NJ4S funding, which was shifted recently in this budget to substance use prevention dollars that are set aside through the Cannabis Regulatory Enforcement Assistance and Marketplace Modernization Act, which sets up the licensing structure and fees for cannabis dispensaries in New Jersey. Within the context of an already challenging budget, we had to make some additional painful decisions for programs that we know have worth and value for all New Jersey residents. I said previously that this was a budget of priorities, and I noted that where possible, we tried to avoid zeroing out any programs to allow them to continue to serve New Jersey residents, even if that was in a more limited capacity. The governor's proposed budget supported the DCF core functions and strategic priorities, but there were still some hard decisions that need to be made. So luckily, over the spring, the state revenues did begin to increase. And through the budget negotiation process between the governor and the legislature, some of those cuts that we needed to put forward were able to be restored by the legislature, which is really great news. Even with the restoration of some funding, our final budget is still a little bit below where we were in FY25 as far as direct state appropriations. It's also worth noting that while the figures I'm presenting today reflect DCF's final budget, there may be additional funding in other state department budgets through the legislative budget resolution process that directly supports children and youth and families in New Jersey. And one example of that is funding for school mental health programs that may be in the Department of Education budget. So on our next slide, you'll see that as far as our funding on child safety initiatives, this was one area where we didn't have a lot of flexibility initially in the proposed budget. So there wasn't a lot to cut from child safety programs. Much of our budget for child safety is tied to federal reimbursement from Title IV-E, Title IV-B, Social Services Block Grants, and other federal funding sources. Among the restorations in the child safety space was funding for 4 of our regional diagnostic treatment centers, the Winona Littman Child Advocacy Center, the Audrey Hepburn Children's House Regional Diagnostic Treatment Center, the Dorothy B. Hirsch Child Protection Center in Middlesex County, and in the Office of Higher Education budget was they renewed dollars, the allocation for the CARES RDTC in South Jersey. So all of this thanks to the advocacy with the governor's office and the legislative partners by many of you. And because families, and particularly children who are involved in child protective service cases, require support during legal proceedings, the legislature also restored cuts for the Essex County Family Justice Center and court-appointed special advocates, or you may know them as CASA. In our prevention services in the governor's proposed budget, we did maintain funding for many of our prevention priorities, including 2 of our innovative programs, which are positioning New Jersey as a leader in the child maltreatment prevention space. The governor included $12 million to support the expansion of our Family Connects NJ Universal Newborn Home Visiting Program, which will allow us to expand services to 6 additional counties beginning in January 2026, which means that families welcoming a newborn in Camden, Salem, Atlantic, Burlington, Cape May, and Monmouth counties will be able to schedule a nurse home visit in the new year. Following the January 2026 expansion, that will leave us only one more wave of counties to bring online to ensure that Family Connects NJ has statewide reach and is truly a universal program for all of New Jersey. Additionally, the governor maintained the $43 million budget for the New Jersey Statewide Student Support Services Program, or NJ4S, to continue the program into year 3. And if you recall, as I mentioned at the top of my talking points, 34.6 million of the $43 million program budget is now funded for NJ4S with New Jersey's cannabis licensing dollars. In mental health, on our next slide, one area where the legislature provided some additional support, or this is where the legislature provided some additional support beyond the governor's proposed budget around youth mental health programs. The final Appropriations Act increased funding for the children's system of care by about $19 million, which was really a rebalancing to our CSOC trend accounts, ensuring that we will have the funding necessary to support children and youth receiving services through that CSOC continuum. And those dollars fluctuate from year to year, but this means going into the year, we know we'll have what we need. The final Appropriations Act included an additional $1.65 million for digital mental health innovations and partnerships with Insight Health, Kooth, and Hazel Health. And this increase came from legislative budget resolutions. The final budget also saw the restoration of funding cut from the Child Collaborative Mental Health Care Pilot Program, commonly known as the Pediatric Psychiatry Collaborative. This program implements a best practice collaborative model to increase access and capacity to pediatric mental health and substance use treatment through a partnership with primary care physicians, pediatricians, and referral to specialty care services when clinically appropriate. And while it is not included as a line item in the budget, DCF was able to secure budget language to carry forward $30 million dedicated in last fiscal year by the legislature for youth mental health services. So that's in this budget as well. Another area where the legislature restored funding was around domestic and sexual violence services, including $2.2 million for domestic violence services and an increase for sexual violence services by $4.9 million over what was allocated in the FY 2025 budget. The restored funding in full or part was for the Latino Action Network at the Hispanic Women's Center, Project Sarah, domestic violence program, and culturally specific programs like Bolo Bahen, supporting the South Asian community in Hudson County, and Shizori House, supporting Muslim women in Middlesex County. And lastly, the legislature appropriated $750,000 for Empower Girls Now, a nonprofit agency dedicated to ensuring equality and dignity for girls in New Jersey and around the globe. So we'll hear from our experts a little later this morning on what the expected federal impact is to New Jersey. And we recognize that some of the federal funding reductions are scaled over time so that you may not feel an immediate impact. But the situation around federal funding is incredibly fluid, and the governor's office and the state treasurer are monitoring, along with the departments, the federal funding landscape in order to ensure New Jersey remains on solid fiscal ground. Looking ahead to the fiscal year 27 budget, yes, planning for next year's budget has already begun. I anticipate that the budget process being equally or more difficult than this year 26 because of those federal funding reductions that will be scaled in during that fiscal year. So with a new governor soon to be elected in New Jersey, just under 3 months away, if you can believe it, we know that they will have their own priorities, their own policy priorities, ideas, and initiatives. And I would expect next year's budget will reflect that. So all of that to say that a budget, as you know, is a reflection on the leaders crafting it. And we've been afforded the resources at DCF over the last 7 years to do some really innovative and transformational things for New Jersey's children and families. I hope we can continue that momentum of innovation moving forward as the next administration shapes state government through their budgetary decisions. So at this time, I would like to invite my DCF colleagues, Kristen Matera and Karen Baldoni, to discuss grant terms and conditions and contracting considerations. So welcome, Kristen and Karen.
Thank you, Commissioner. I will be going first. So good morning, everyone. I'm, as Commissioner said, Kristen Matera, and I'm the Federal Grant Manager in the Office of Grants Proposals Management and Reporting Department. I will discuss recent updates and changes at the federal level and some ways that those changes are showing up, in particular in the terms that apply to funding requirements. I will be focusing on changes that involve diversity, equity, and exclusion, or DEI, as it's commonly referred to. However, the implementation processes for some of these changes, from executive order to the federal agencies issuing guidance, is generally applicable to different changes that are being issued through executive orders. The information will cover changes that are relevant to DCF's providers that receive federal funds, whether received directly from a federal agency or even indirectly from DCF or another state agency. And the changes are relevant for providers even if they're not receiving federal funds. And we'll discuss some of those changes in detail, highlighting where the changes are tied specifically to federal funding terms and conditions, and where changes are applicable to private entities that are subject to other federal laws. These changes are also finally, I will briefly identify recent changes that have not yet been implemented, but that may have implications for providers and anyone on this call once they are. And then I'll turn it over to Karen Baldoni, the Director of Contracting, to discuss more about the terms that are related to federal funding in DCF's contract. Next slide. Each executive order includes statements of policy and specific directions to certain federal agencies that detail what must be done and when they have to do it by. This graphic on this slide illustrates the process with regard to the implementation of the Ending Illegal Discrimination and Restoring Merit-Based Opportunity Executive Order that was issued in late January. 3 agencies subsequently implemented the DEI prohibition that were included in the executive order, and that the agencies and the specific issuances that are most relevant are included in the slide as well. This doesn't include every issuance or guidance document that is relevant to this executive order, but these are the most essential documents, I think, for understanding the parameters of what the policy changes encompass. So first we'll focus on Health and Human Services, which implemented the terms and conditions, or the new policy and its terms and conditions that apply specifically to recipients of federal grant awards. Policy updates were also issued by the administrative units within the Department of Health and Human Services including the Administration for Children and Families, or ACF. And these standard terms and conditions are most relevant here for the department and to many providers who receive funds through contracts with the department. The next document issued were from the Department of Justice and the EEOC, the Equal Employment Opportunity Commission. Department of Justice issued non-binding documents relating to enforcement, and another document that was recently issued in July that is specific to recipients of federal funding. The EEOC guidance is relevant not only to recipients of federal funding, but also to private entities, any private entity that is subject to the laws related to civil rights, specifically Title VII, the Civil Rights Act, and that is to any employer who has more than 15, I believe, 15 employees, and then the age discrimination laws apply if you have more than 20 employees. Next slide. So the standard terms and conditions that were implemented by ACF are broadly applicable, more so than the Health and Human Services other policy documents regarding grant funding, which that applies to discretionary grant awards. The ACF terms and conditions apply to any sort of federal funding, and they were updated several times this fiscal year, which is very unusual. Typically, they're updated annually at most, and we have seen so far 3 revisions. The most recent revision actually undid some of the changes that were previously made to the DEI-specific civil rights assurances that required recipients to agree that they would not violate the prohibitions of illegal DEI. At that time, there was not much guidance or clarity as to what illegal or impermissible DEI encompassed. Since that time, and through additional agencies issuing guidance documents, how the administration understands prohibited DEI has become a lot more clear. The most recent revision removed the DEI specific language and replaced it with anti-discrimination laws certification. So this occurred on July 29th, and the revision that had occurred before that had just been issued on July 25th, which actually had added in a lot of language regarding DEI. And the reason for the second revision on the 29th becomes more clear in connection with the DOJ guidance, which we'll get into in the next slide. I just want to highlight here that when you're looking for what currently applies to federal funding awards, this is a good place to look. The actual website, because they include a link and the effective date of the guidance that you're looking at. If you're looking just searching on the internet, you could have search results that include previous versions and not necessarily realize it. The current version is also indicated on the footer of each page. So also look to that and make sure you're not looking at a prior version of this issuance. Next slide. So I had previously mentioned that the initial prohibition was somewhat unclear and undefined. And now that we have additional agency guidance, it has become more solidified how the federal administration will be enforcing this prohibition, and the integration of the prohibition with other civil rights laws. And so the ways that it's interpreted to violate the laws against discrimination are clarified, I think, most explicitly in the guidance that was issued on the 29th. And that was in the first slide that we went over, the link to that guidance. And it provides examples of prohibited practices and best guidance to help understand ways that providers could review their policies to look at the alignment between what they're doing and what is now considered prohibited. The policies have shifted considerably, and how they're interpreting civil rights laws in these policies and guidance documents is a considerable expansion upon how those laws and legal principles had previously been interpreted. And so they do provide useful information. The EEOC guidance, like the DOJ guidance, does provide clarity about how these terms will be interpreted and how the federal agencies are enforcing these laws now to encompass DEI. This, again, is specific to civil rights laws in the employment context. And so that applies more broadly than the federal recipient guidance. Next slide. So we were discussing specific changes regarding DEI prohibited practices that may be broadly applicable in programs and activities, and they may also be applicable to the personnel policies of an entity and the training programs that are provided to employees. Upcoming actions and pending actions that we're keeping an eye on and that may be relevant once they're implemented to providers and anyone on this call are included in this slide. And the initial documents that were issued are also included. And the immigration, in the immigration context, whether or not federal public benefits will be impermissible to certain individuals that previously could receive them, that's currently being litigated. So we have some more guidance on how that implementation would take place if it were permissible at this point. And those documents are provided. The LEP access, the limited English proficiency, refers to guidance documents that have been in effect for a long time and were recently rescinded. And that applies in particular to funding recipients. The DOJ implemented the executive order that called for rescission of all of the current guidance. And now we're waiting to see what the next guidance will look like. We know that it will focus on finding initiatives or finding areas that would benefit from a stronger focus on English language and where translation and other access services can be, according to the agency, be prioritized. The third upcoming issue that we're keeping an eye on is housing and mental health, and that's in connection with a recent executive order that is focused on homelessness, as it's termed in the order, and providing stronger civil enforcement requirements for individuals who are experiencing significant mental health, substance use, or housing concerns. And so there was, again, guidance in that executive order to federal agencies, and we'll see how that will be implemented. But it will impact certain grant funding that's also identified in that executive order. So with that, I'm going to hand it over to Karen Baldoni to talk about the specifics of where you can find these terms.
Hi, good morning. Okay. I have one more slide. There's one more. Thank you. And the slides in between, I think, as I was seeing things in the chat, will all be, I believe, provided following today's presentation. So good morning. Thank you, Kristen. I'm Karen Baldoni from DCF's Office of Contract Administration, or OCA, and my office manages DCF's 6 business offices: Central, Metro, Northern, Southern, the Children's System of Care out-of-home contracts, and the business office for CSOC's community support contracts. If your organization has a contract administered by any one of the 6 DCF business offices, your agency is signed DCF's Standard Language Document, or SLD, as part of your contract package. It's a multi-page document, but given the focus of today's forum, I wanted to focus on understanding the impact that decisions at the federal level are having on DCF's contracts. I wanted to call out one section within the SLD, section 3.03, compliance with laws. As you can see, when an organization signs the DCF standard language document, in that section, the provider agrees in the performance of the contract to comply with all applicable federal, state, and local laws, rules, and regulations. And so again, with today's focus being on how changes at the federal level may be impacting providers' contracts, that may lead you to wonder and ask yourself, how do I know if my DCF contract has federal funds? So within your contracts, if you happen to have a form like the one on the bottom right side of your screen, that's called our SEC form, or our scheduled payment form, that's within our cost reimbursement contracts. This would be the document or one of the documents within your contract paperwork that would help you identify whether or not you happen to have any federal dollars within your contract. Next slide, please. So if we look a little bit more closely at the form, you'll see, well, I don't know quite how it transposed here, but there was a blue arrow. I think it's a green arrow. And if you look, it's the horizontal one. It's pointing to something called the Federal Assistance Listing Name, or the ALN, which was previously known as the CFTA number. And the ALN, that's the title or the name of a specific federal grant or federal program. And the name is the descriptive label to identify that grant that's been provided to DCF or to anyone from the federal government. And in the example that we're looking at on screen, this particular account ends with an ALN number of 93.599. And so that's the account, or that's the federal grant that happens to be supporting this example contract. And then if you look at the vertical arrow, the green one pointing down, you'll see it's pointing to the number 25. And that's the year 25. And that's the fiscal year that this particular federal funding is coming from. And so if you were trying to find out more information, some of the information that Kristen was discussing during her presentation, you could go to the DCF website, and the link is at the bottom of the page, to take you to the active federal grants awards, which is where DCF stores all of its active federal grants, and much of the information, including terms and conditions and supplemental terms and conditions that are specific to the different federal grants that DCF receives. So if we go to the next slide. So using our fake contract SEC form, once you get to the DCF website, you could look for your ALN number. In this case, it's the 93.599. And then you could also look for your fiscal year of 25. And this is how one way that you could link to the federal supplemental terms and conditions that are specific to the grant. But at the top of this page, the active federal grants awards, we've also been updating and providing links to the federal guidance documents that we've been receiving over the past many months as changes have been happening at the federal level. So next slide. All right. And so this chart, this is a snapshot, sorry, of the federal grants that are awarded to DCF from the U.S. Health and Human Services, within which is the Administration for Children and Families, or ACF. And we have updated guidance documents from ACF. And so on this chart are all of the active federal grants that fall within ACF's terms and conditions. And these are grants that are currently used by DCF in their contracts. So I also want to point out in the very first row, we identified a grant that is not from Health and Human Services, it's from Department of Justice. We have one grant right now that DCF receives that comes from Department of Justice that supports some of our contracts with providers under contract with the Division on Women. And so it's not ACF, but we've also received guidance documents from them. And so we wanted to include it on the chart at this time. And so the benefit of this chart for right now is if you happen to be looking at your SEC document and you confirm you see the ALN number, you happen to locate an ALN number in your contract paperwork, you can use and cross-reference the ALN number to this chart to the federal department to see whether or not the funding happens to be coming from ACF or not. And I did just want to point out that while this right now is listed or specifically identifying grants that DCF receives from ACF and the one from the Department of Justice, we do receive federal grants from other Health and Human Services divisions and from other federal departments that we may not yet have received any updated terms and conditions. So we didn't include them at this time on this chart, and we don't have any guidance documents from those other departments at the federal level yet on our website, but we'll continue to update our documentation on the federal web or on our state website, I'm sorry, with federal information as it becomes available to us. And we'll also be working to look through our documents to see whether or not there are any changes that we need to make to contract documents or other information that we share with you. So that's all I have for this morning. And I think at this point, I'm returning back to Commissioner Ryer.
Thank you, Karen and Kristen. And I'm not seeing any questions in, in the Q&A section for either of you. So I don't know if anyone has any questions. You want to go ahead and add them now. Otherwise, I think we are at a place where we are going to take a quick break. Okay. So there's a question about can individuals on the call apply for these grants? So I'll just say that the grants that Karen's talking about are they're not open competitive grants right now. The grants that we get that the department receives from the federal government, we then end up that money gets RFP'd out to our provider community in the form of many different types of services. I don't know, Karen, if there's anything else you want to add about that, but I think, because I don't think the grants you were talking about are open competitive.
Correct, they are not. They're through RFPs or they're with existing providers and expanding on services they're already providing.
Okay. And I think there was another question about, did your chart reflect all of the DCF federal grants?
It does not. It includes those that are specifically from ACF and the one from the Department of Justice, but we do receive other grants from where we're the subrecipient. So I did not include, because we don't have the information yet for the funding that we receive, the MCFE funding that we receive from our partners at the Department of Health. That would be a separate guidance document. And there's other funding that are from other divisions or departments at the federal level that were not included yet on the chart. But I will say on the website, we do have all of our federal grants, whether they come directly to DCF or we're the subrecipient. But I didn't have time or didn't have the guidance documents yet to include it on that snapshot chart in the presentation.
Scary. There's another question here about, is there a list of terms that providers should be adjusting in their programs or in their programming? And I think that speaks, Kristen, to what you were talking about. You're on mute.
Sorry about that. There's not a specific list of terms to adjust. The basic takeaway is that certain activities and programs that used to not just be permissible, but required in some cases, are now viewed very differently. And to be aware of how those changes are being implemented and enforced. The documents that I went over in my presentation provide a lot of information about how their different activities and programs that involve DEI are being viewed at this point, and also what would be considered a violation of current civil rights laws and related anti-discrimination laws. And so having an awareness of those and potentially looking at how they align with your policies and your activities, and assessing that would be the terms that are being referred to here. The standard terms and conditions documents, they have general terms. They cover all of the different administrative requirements. So those are very important to be aware of as well.
Thanks, Kristen. And I would just add that for anyone on the call that's questioning this or questioning, are you in compliance with the terms and conditions of your existing contracts with DCF? Which also extends then to ensuring that you understand the federal requirements, that you seek legal counsel from your attorneys, and that you're internally discussing and ensuring that you feel comfortable that you're meeting the terms and conditions. And so I would say, I think there was a question about what's the major takeaway, from this section. I mean, I think the major takeaway is ensuring that you understand and recognize whether or not you have federal funding in any of your state contracts, which then implicates your terms and conditions to be in compliance with the federal requirements that Kristen went through. And I would say the other thing is really ensuring that you're educating yourself and those that work with you about what the changes are at the federal level. Kristen provided different resources and websites for you to be able to gain that information. We do have some of that also on the DCF website, and you will end up getting the slides. They will be sent to you after this presentation today. And so you'll then have that information readily available to be able to go to the sites to then, kind of do your own research and exploring. But we felt it was important for at least to start to point you in that direction and ensure that you have the knowledge about where some of this exists within your current contracts. Okay. All right. So we are going to move into our next section. And so I'm happy to introduce Mary Coogan.
Thank you, Commissioner. And for everyone who's on the webinar, I'm sorry, we are going to take your break away from you for timing purposes, because we do have our next speaker has to be at another engagement. But I am Mary Coogan, President and CEO of Advocates for Children of New Jersey. And as Commissioner Byer said, we have partnered with DCF doing these forums, and I didn't realize it was 7 years. First, in person, where we learned a lot of information from many of you. And then most recently, we've been doing them virtual because more people could attend for these updates. So I have the pleasure of introducing our next speaker, Danielle Ewing, who is a policy and strategy consultant with 6th Street Associates, serving clients including philanthropic organizations, state and national advocacy organizations, and policy and research groups. I actually know Danielle from a weekly call that she does for the Alliance for Early Success. But prior to the position that she has now at 6th Street Associates, she served as a senior advisor to the Office of Early Childhood Development at the U.S. Department of Human Services, or I guess it was Health and Human Services, and oversaw the development of policy. She also was a director of the Office of Early Childhood Education in the District of Columbia Public Schools, and she oversaw the operations of programs serving 3- and 4-year-old children in high-quality comprehensive classrooms. And prior to that work, she also worked at the Center for Law and Social Policy, or CLASP, as many of us know it, and was the deputy director of child care team at the Children's Defense Fund. So she brings with her a wealth of experience in early learning, but what you're going to learn from Danielle is that she really does have a handle on what is happening in Washington, as chaotic as it may be from day to day. And she is going to give us an overview of the current status and its impact on early childhood education. So I'm going to ask if Jason, you can put up her slides. Thank you.
Thanks for the introduction, Mary. Can you hear me okay, Mary?
Yes, I can hear you.
Great. So if you can just go to my first slide, that'd be great. So I was asked to give an update on what's going on federally and how it impacts early childhood education, childcare, and early childhood. And even the name of this first slide is a little bit misleading. I'm really not giving you an early childhood update. I'm giving you an update on what's happening at the federal level and how it might impact early childhood programs at your state and local level. So if you can go to the next slide, I'm going to talk a little bit about a couple of things. I'm going to talk about some things that happened in Congress over the last year, particularly the budget reconciliation bill, the one big beautiful bill, and some of the main components. I'm going to talk about other things Congress is doing, and then I'll move very briefly to some of the administrative actions that are sort of the background for what you just heard from your state staff. So if you can go to the next slide, we're going to start by talking about congressional actions. So if you go to the next slide. So the first thing to talk about is the fact that Congress passed and the president signed on July 4th, the budget reconciliation bill known as the One Big Beautiful Bill. And just to remind everybody, this was a special process that Congress went through that happens when the House, the Senate, and the White House are controlled by the same party. It is not an unusual process. Different presidents have used it in different ways. President Bush used it to pass tax cuts. President Obama used it to pass the Affordable Care Act. President Biden used it to pass the Inflation Reduction Act, and President Trump used it in his first administration to also pass tax cuts. So this is something that has happened many times before. It's a special process because it only requires 50 votes in the Senate to move something forward. And indeed, they did move forward a really, really big bill that does 5 things. And I'm going to quickly go through some of those things. The first thing it does is it makes significant tax changes. It makes the tax cuts that were put in place during the president's first administration permanent, adding about $3 trillion to the federal deficit. This was one of the primary goals of the whole bill. The majority of the tax changes that are in the bill accrue to upper income families and to corporations. And this means that there might be some changes to your state revenues, to the degree that any of your state revenues are tied to federal taxes. But in making those tax changes, the Congress also made some important changes to programs that benefit families with young children. Most importantly, they made the expiring child tax credit permanent and increased the amount available to families. Unfortunately, they did not make the tax credit refundable, so low-income families are not eligible for the credit. They also made it more difficult for children living in mixed status immigrant families to access the tax credit. So while we were happy to see a small change to the tax credit, overall we are concerned that it won't benefit low-income families across the country. Congress also acted to make some changes to the child dependent care tax credit to make it easier for employers to access 45F, which is the employer provided child care tax credit, which helps them invest in the supply of childcare or provide scholarships for employees, and to grow dependent care assistance plans. Again, things that allow working families to offset some of the costs of childcare. So again, we were happy to see some of those small changes, but overall, the tax changes that are in the bill don't accrue to low-income families and grow the deficit significantly. In addition to the tax changes, one of the other 5 things that Congress did was they invested heavily in national defense and in immigration enforcement. And together, those changes, along with the tax changes, grow the deficit by about $4.5 trillion. To offset the growth in the deficit, Congress also made a number of changes to entitlement programs. And that's what you've likely seen in the news. And so if you can go to the next slide. If you can go to the next slide. So one of the big changes that was made, and I think that other speakers will talk about this as well, was to Medicaid. And it's really important, as you can see on the slide, to really understand the impact Medicaid has on low-income children and their families, as well as on the early childhood community. About 1 in 4 early childhood educators relies on Medicaid for their health insurance because, as we all know, our providers are undercompensated, and so they are eligible by income for health insurance through the federal Medicaid program. And Medicaid supports a lot of the resources that make sure children and their parents are healthy. It covers many of the births in this country. About 40% of children under 6 rely on Medicaid solely for their health care. An average of 50% of the patients at children's hospitals rely on Medicaid, and at some of those children's hospitals, it's as high as 70 to 80% of patients are Medicare beneficiaries. Medicaid is also the 4th largest source of funding for K-12 schools, with schools receiving money to help provide services for low-income students who have disabilities. So you can see that changes to the program that may make it more difficult for families to access services are deeply concerning. The bill cuts about $1 trillion for Medicaid, as you can see on the slide. And the Nonpartisan Congressional Budget Office estimated that about 10 million people over 10 years will lose access to health care because of these changes. And that in addition, with additional changes to the Affordable Care Act and the CHIPS program, then that number may grow to as much as 17 million people losing access to health insurance. They will lose access to health insurance for a variety of reasons, including really stepped up reporting requirements, work requirements that are much more difficult for families to meet. And so it's going to be incumbent on your state to think about how to make sure that new requirements that are put on families are as limited in their burden as possible. And what do I mean by that? Well, states are going to have to think differently about the application for these programs, and it can be a 30-page application or it can be a 1-page application. And so how are we making it as easy as possible for families to stay on these programs? In states where these kind of changes have been put in place, Arkansas, Georgia, they found that the burdensome requirements pushed people who were otherwise eligible off the programs. And so again, it's really important for the state to think about how to make sure that families can stay attached to these programs. We know that when children don't have access to health insurance, they are more likely to miss school. They're more likely to have chronic health conditions that are out of control, that the communicable diseases spread more easily throughout schools and other community events. And so we want to make sure that as many people as possible hold on to their health insurance, even with these changes and cuts that are significant and will make a lot of families ineligible. So that's what happened with Medicaid, and I can answer more questions about that if there's some in the chat. But the other big thing that Congress did was it made a systemic and generational change to the SNAP program. That is the food stamp program that we all know about. So they did a number of important things to change the program. They limited the thrifty food plan updates. That is how the food benefit, the amount of money families get to pay for food, how that is generated. In the past, the administration had flexibility to grow the amount of the food benefit if the prices of food were going up faster than other costs. That Congress eliminated that flexibility. But even more importantly, they put in place a number of changes to work requirements that will lead that were not in place before. So many more people will have to go to work for 80 hours a month, 20 hours a week, which may be particularly difficult for those with who have jobs that have just-in-time scheduling, for those folks who are self-employed, for those folks who have multiple jobs. They will still have to demonstrate that they meet these work requirements. And again, those are burdensome paperwork requirements that can keep folks from benefiting. I'm not sure if you're on the right slide. Can you go to the slide that has SNAP on it, please? Thank you. So you can see on the slide some of the other changes. The Congress also made changes to how the SNAP program is paid for. Previously, the costs of administering the program were shared 50-50 between the federal government and your state. What they have done is they've changed that percentage so the state has to cover 75% of the costs and the federal government will cover 25%. In addition, the food benefits, again, the amount of money that families get, was previously covered entirely by the federal government, and now your state will have to pick up some percentage of that cost, somewhere between 6 and 15%. And what that means is that your state, which has had an amount of money they had to pay for administration, will now be responsible for a higher cost. There will be a bigger impact on your state budget, and the state will have to figure out how to pay for these costs. And so we've already heard from about 23 states that they may not be able to fully fund the program and that they may make major cuts to who is eligible for SNAP, who's eligible for Medicaid. And that will lead to a number of changes in child nutrition, hungry kids showing up at school. We even have one state that has already said that they may not be able to continue to participate in the SNAP program, leaving children and families without access to resources to pay for food as food costs continue to rise. So you can see that there are real impacts on your state budget. There are real impacts on children and families. The other thing to think about is both the Medicaid changes and the SNAP changes will require your state to make changes to their data systems that manage all of these little pieces of information about children and families, and that on its own has a cost. One estimate from one state was that just implementing those data changes would be about $90 million. So again, every aspect of what I'm talking about that was passed on from Congress down to states will have a budgetary impact on your state. Will force them to find funds that they've never had to put up to these programs before. And that means that from an advocacy perspective, there are going to be tensions, and we have to figure out how to make sure that we protect children and families as they move forward. So if you can go to the next slide, the Children's Funding Project, which is an organization that looks at the impact of these things, has looked at how these cuts will affect children and youth. And you can see that there are very direct effects that I've talked about. Fewer people will enroll, the states won't have the money to pay for those programs. But if you can hit enter and just go to the next visual on the slide. So you can see that there are what we call downstream effects that are deeply impactful for children and families. Fewer providers that can serve families on Medicaid or can take Medicaid. Much poorer health outcomes for children and families. Poor child nutrition and an increase in in food deserts as there are fewer people to pay to support grocery stores in low-income communities. So there's a lot of downstream effects from these changes to the bill that are important to think about. But that's not all they did. So if you can go to the next slide. The other thing that I want to talk about is we think about the impact of the bill on early childhood programs. There are a number of changes in the bill to higher education programs. The bill importantly affects a lot of the student loan changes that President Biden put in place. They've eliminated a lot of the income-driven repayment plans. They made some changes to Pell Grants and some changes to credit hours. But importantly for our community, they put in place language that restricts access to federal loans for low earning programs that come out of institutions of higher education. What does that mean in regular people speak? Basically, what it means is that if there's a program at a university or community college and the graduates don't make salaries at a high enough level to be determined by the Department of Education, then that program at that institution can't access federal loans like Pell Grants, like student loans. And so for our community, we know that our folks who go to school to get an AA or a BA in early childhood, or social workers or other caregiving fields, they often don't make particularly high salaries. Their compensation is very low, as we know. And so there's a real concern that universities will eliminate the programs that make bachelor's degrees, associate's degrees available to those folks because they are afraid of losing access to federal loans. And so this is something in your state to really be paying attention to and to be thinking about, are there opportunities for the state to offset any losses to federal loans to make sure that we continue to have those programs that support access to higher education for our early childhood community. So if you can go to the next slide. Part of well, there is no good news here. Part of what's important to understand is that the bill is implemented in such a way that we have time to plan, we have time to work with our state agencies, both your DCF, the folks that administer Medicaid, the folks that administer SNAP, to really think about how to put the best possible policies in place that can support children and families rather than harming them. Many of the pieces of the bill that I've just talked about don't actually go into place until the end of 2026, after the midterm elections, or even in some cases, as you can see on the slide, after the end of the 2028 election. And so we do have a little bit of time. So if you can go to the next slide, I talked about Congress doing its job to pass the bill. They also have to, every year, as we've all talked about in many other places, have to do annual appropriations. Every year, Congress must fund what we call the discretionary side of the budget. They have to do this every 12 months. And that includes programs like the Child Care Subsidy Program and Head Start and IDA, which funds services for children with disabilities, the Community Services Block Grant, the Social Services Block Grant, Preschool Development Grants. All of those pieces have to be funded every single year. And that requires both the House and the Senate to act. And this year, as we've seen in many years, the House and the Senate are far apart. The Senate, which has operated in a bipartisan fashion, has moved forward some of its bills and said, we're gonna do this as we normally do, and we actually think these programs should be well funded. And they voted, they have proposed increasing funding for the Child Care Subsidy Program and for Head Start by about $85 million each. Not a huge increase, but an increase. The House, on the other hand, has said the president told us to cut funding to reduce the size of government. And so we're looking at cutting all of these programs. It's unclear how the House and the Senate will get together. In the past, sometimes we have negotiations, we end up with agreed upon numbers. Sometimes we end up with a continuing resolution. Sometimes we end up with a government shutdown if they can't come to agreement by September 30th. This year, it is very difficult to see how they're going to move forward because the president has also acted to do what's called rescissions, where he holds back money. He has asked Congress for approval to do that in one case around the foreign service dollars and NPR and PBS. But he's also withheld other dollars without asking for their permission. And so that has led to a lack of trust in Congress. And you can see there's a number of articles that I put on the slide that talk about how hard it is to come to an agreement when there's this lack of trust. And so we just don't know what's going to happen. But it's our job as advocates to continue talking about the value of these programs, talking to our members of Congress about why we need to invest in these programs, why they need to grow, the impacts on children, the impacts on families, the impacts on our community, to tell our stories. We're not going to figure out the process part, but we need to do our job to tell the story about why these programs are important. So if you can go to the next slide and then the one after that, that'd be great. I know I'm talking really fast. I apologize. So I just wanted to sort of underscore some of the things that your state folks talked about before, which is this administration has a number of priorities that they are putting in place through a bunch of different levers of government. And frankly, a lot of the way that they're doing things has never been done before. And so we are all playing catch up to understand how this all works. So one of the things they're doing is when they don't want to fund something or when they have questions or concerns, they are withholding funds. And we've seen that withholding happen with Head Start funds. There are Head Starts across the country that have had to close classrooms or even shut down because they couldn't access their grant funds. We saw over the summer, the administration withheld about $9 billion of education funds in Title I in 21st Century. Through litigation and public pressure, they did release those funds, but we do expect there will be other efforts to impound those funds. We've also seen guidance, as your state staff talked about, around the administration's point of view on diversity, equity, and inclusion, around parent choice, and access to public benefits for immigrant families. This latter one, we know that they put out guidance about a month ago saying that immigrant families could not access certain programs, including Head Start and Title 20 contraception family planning services. That went to court. That has been paused, at least in the states that were party to the suit. We do not know how they are going to move forward with implementation guidance on those things. But as you heard from your state staff, there are a lot of questions about how to move forward. And the best answer is always to be really thoughtful and to go and get legal counsel before you act. There have been a lot of leadership and staffing changes. The administration cut the Department of Education by more than 50%. They made cuts within the Department of Health and Human Services to the folks that administer our core programs, and those continue as they move forward with their agenda. We've seen a lot of litigation. It's really important to know that within the lower courts and the federal lower courts, we've had a 90% win rate for those suing the government. When things have gone to the Supreme Court, the administration has had a 90% win rate. So again, there's a lot of unknowing in how any of this is going to play out. And it's really important to act slowly and thoughtfully before you make changes to programs, to understand what's being required and what's being asked for. And obviously undergirding all of this is significant immigration enforcement. The bill, as I talked about, the One Big Beautiful Bill, across the board makes changes in multiple ways to make it as difficult as possible for families, even mixed status families, to access services. They've recently put in place, as part of the bill, really significant increases in the costs that are part of applying for different visas, different immigration status. And of course, we've all seen the stepped up immigration enforcement across our communities. And we know how harmful that can be to children and their families. And so as I end, I just want to remind folks that it's really important that we keep our advocacy hats on, that we are here to talk about the needs of children and families to whoever will listen. Your state needs to be planning for how to implement the big changes that are coming through the One Big Beautiful Bill. And that's going to require talking to your state legislators. What are we doing? How are we planning for this? It's going to take talking to those in administration of Medicaid, in administration of the SNAP program. How are we making sure that families can continue to access these services and remain eligible? It means talking to folks in your community, talking to your local city councils, talking to your county agencies, talking to your religious leaders, and making sure everybody understands that we have an obligation to protect children and families. And what are we doing to do that throughout every part of our community, in every part of our state and federal legislation? Who are we talking to and how are we carrying our message? So I'm going to stop there. Mary, I don't know if we have any questions or if there's things I can quickly address, or if you want to go on to John.
So I think we're going to move on to John, because I know you also have to skedaddle. I don't know if anybody had something very quick, but I think Danielle, I think that was a great presentation, and I'm going to let you go. And if there's something we can't answer after John's presentation, then I will send you a text. But thank you so much for that.
That sounds great. And you're in wonderful hands with John. He and I go way back, and he's a wonderful advocate as well. So thank you, everybody. Bye-bye.
Thank you, Danielle. And I'm going to turn the microphone back over to Commissioner Byer to introduce our next presenter.
Yeah, thanks, Mary. And, big thank you to Danielle for her info. So important. And our next presenter is John Sciamana, a senior policy consultant with the Child Welfare League of America. Before shifting to a policy consultant position, John was the vice president of public policy for CWA, a role from which he retired in 2022. During his term as vice president, John worked to secure partnerships with the National Child Abuse Coalition, the National Child Care Coalition, the Child Welfare Mental Health Coalition, Voice for Adoption, the Home Visiting Coalition, and the Coalition on Human Needs. He focused on a range of critical children's programs and policies, including prevention initiatives, child welfare financing, the development of the nation's child care block grant, and implementation of TANF. Prior to working at CWLA, John has experience working for the Speaker of the Michigan House of Representatives, worked as a legislative assistant in the United States Senate for Michigan Senator Donald Regal and Senator Barbara Mikulski, and working in advocacy positions at several Social Service Agencies Association, or APHSA, and National Foster Care Coalition. So John will be speaking to us today about the specific impact to New Jersey resulting from the federal reconciliation process. And we're so grateful to have his expertise on this morning's presentation. So welcome, John.
Thank you. And I guess we can start there. And so Katie Mappa, who is the Director of Government Affairs for the Child Welfare League, put this together. And there's also links in this for some of the data that will be in here, some of it New Jersey related. So that'll be awfully useful. But you can go to the first slide, which again, we'll be talking about, touching on some of what Danielle already said, but going a little deeper in certain areas. But the key takeaways here, this is from the Yale Budget Lab. The overall bill, the bottom 40% of American households will be losing income, while the top less than 1% will gain an extra $118,000. Again, that's the Yale Budget Lab. This is the overall impact, because we're looking at not just tax cuts for certain individuals, but also some of the program cuts that you've just heard about, and the 17 million that Danielle mentioned in terms of loss of health care through Medicaid and the Affordable Care Act. You can go to the next one slide, which also mentions some of the impacts in terms of the SNAP cuts, 16 million children. There was a 365% increase in the ICE budget for detention and for more staff and more family separation. And so this is a real transfer, a significant transfer of wealth in one big bill. And of course, those numbers come from the Center for American Progress, CAP, that you see referenced there. And again, the link down there at the end of that PowerPoint. You can go to the next slide, which talks about SNAP. And because Danielle mentioned some of these things, the new work requirements. So it's for children over the age of, expands the work requirements to older adults and parents of children who have children over the age of 14. It used to be under 18, the exemption. So that's one example of how they've changed some of the requirements. I just mentioned too, because Danielle went a lot of this, I think the significance too of the fact that states will, under this bill, have to pick up some of the share of the cost of the actual food stamps. This was designed specifically as a program, especially during the War on Poverty. Senator Robert Kennedy in 1968 headed up a Senate committee that took a tour of the Mississippi Delta, and the country was shocked about the level of malnutrition that they were seeing in kids, things that people didn't expect to see except in developing nations. And so this was specifically designed to supply that funding directly to states, so you wouldn't have a 50-state picture, because AFDC was being inadequate in terms of how it was reimbursing families across the 50 states. So this is a hugely significant change in terms of, if it stays on the books, to the food stamp program. So there, of course, are restrictions in terms of non-citizen eligibility. And so that too will have a significant impact. You can go to the next slide here. I want to talk about healthcare and the Medicaid and the able-bodied requirements of the new work requirements. There's a $50 billion fund that's supposed to help offset some of the cutbacks here. So the cutbacks really come in two ways. One, in reducing the number of people who will be covered, the work requirement. and the other one with the changing what's called the provider tax. Let me talk a little bit about the impact that we saw in the states of Georgia and Arkansas that did implement this or tried to implement this in the first Trump administration. But Georgia found out that it took them $100 million to implement its rules. 55 million of that went into a verification system. Ultimately, there was a calculation that it cost them $13,000 per enrollee just to sign them up. That was under these new requirements, states will have to verify recipients' eligibility monthly and do a redetermination at least twice a year. So the complexities of those things are going to be really challenging, and that's why so many of the projections are around 12 to 13 million people getting knocked off Medicaid, not because they're not working, but because of some of these requirements. So states will need to have a reliable source of data. As we did our weekly call a couple weeks ago, and we had the commissioner from the state of Virginia, who said now he's going to be looking at basically 3 different standards of work requirements, one for TANF, one for SNAP, one for Medicaid, all slightly different, and trying to track this. More importantly, people being able to track this. In terms of what they found in the state of Arkansas, also had a big problem. This was about the same time as the Georgia attempt to implement these work requirements. In Arkansas, information was often conflicting. People received various letters. Some of them, I think, were, according to the advocates, 20 pages long. So people were losing eligibility because of the confusion. Think of the impact of people who may not receive this information and will go to the doctor, and then we'll find out then that their Medicaid was cut off. There are supposed to be some exemptions for people with disabling mental disorders, but that is up to the Secretary of HHS to issue guidance on that. So how you will do that, how you will track that, how people will track their own hours, if they have changing hours, or people are concerned about what we call the gig workers, people working through various internet-based forms of work. You can go to the next slide here. Oh, wait a minute. Actually, you don't have to change the slide, but I wanted to mention the other part that I think gets left out in terms of the healthcare. We've talked about 17 million people losing health insurance coverage. Around 13 million of that is calculated to be Medicaid. But the other 4 million, at least, could come through the Affordable Care Act. So there's several things that are going on with the Affordable Care Act. The main thing is, during the pandemic, we expanded the tax credits so that a larger population could benefit by it. We increased, I think, by about 10 million the number of people who are enrolled through the ACA, the Affordable Care Act, to about 21 million. So the administration had taken a few steps before this budget bill passed to restrict some access to Medicaid. Plans are no longer automatically renewed. You know, some of you have employment circumstances where you annually, maybe in December, have to re-enroll. But if you don't make a choice or make a change, you continue to get re-enrolled, and that was the case. But that will no longer be the case under new administration directives. 10 million people last year were automatically renewed through that process, or renewed through that automatic renewal. So that could have a significant impact. Open enrollment has been curtailed. It will end, this is for the national system. It'll end on December 15th. It had been extended to January 15th. Now, New Jersey is one of the 20 states that has their own exchange, so they might be able to address that, or may have a different standard than they can. But nationally, for those other states and those people in those other states relying on the national exchange through HHS, they will have less time to get enrolled. If you're a new enrollee under the Affordable Care Act, you know, you get a new job, you can go and apply, and you could get some automatic eligibility while they were doing the determination of your income and your credits. But that will not continue as another way. The big one is the big change in the Affordable Care Act is they, at least as of the end of this year, will let the expanded premium tax credits expire. And what that had done is really extended some measure of tax credit or insurance premium relief to families up to 400% of poverty. So by comparison, a household of one, that's $60,000. A family of four, that's $124,000. So they were getting some relief and benefit from the tax credits. That will go away. In fact, that population will no longer benefit from that. So lower income people with the expanded credit would be capped at 2% or have been capped at 2% as far as their income for dedicated to premiums. Those higher income people I just mentioned, 8.5% was their cap. So some of that goes away, and a lot of the expanded credit, it'll be partially rolled back for some of the families at 150% poverty. Now, where this hits, and particularly more immediately than the Medicaid cuts, is that pretty soon, by November, insurance companies, health insurance companies, will be announcing their new premiums for the new year. A lot of those companies are anticipating that those premiums will go up significantly, because as these credits get rolled back, there will be people dropping out of the system. A lot of those will be healthier people. We had a big push when the Affordable Care Act was enacted, that to get the young, what they called young invincibles, people under the age of 30 who maybe didn't have health conditions and would sometimes skip buying health insurance. So the potential for people like that dropping out of the system because of the loss of the tax credits is going to put upward pressure on health insurance premiums. And if there's upward pressure on health insurance premiums, more people will choose not to be enrolled. The other thing I should mention too, the other piece on the Medicaid, going back to that, is the provider tax. This is significant. This was something that was created, I think, in the late 1980s by states. A lot of states went to their providers, health hospitals, nursing homes in particular, asked them to pay a tax. That revenue was then used by the states to leverage more Medicaid dollars, and in turn, those providers would get a better reimbursement. It's been controversial over the years, but we settled into an agreement over this, especially the last 20 years. States have used it to finance a part of their Medicaid, and this is expected. This is being reduced. And so the loss of revenue to states is particularly going to be impactful on rural areas in the country. And when you look at it closer, there was an article in the Washington Post maybe a couple months ago talking about Romney, West Virginia, a rural area in the Appalachian Mountains that had one hospital that was serving people, and basically I think it was about a 100-mile radius. A lot of people, it was the only health provider for a lot of people driving 30, 40 miles. And it also happens to be one of the main employers for people. So you have the double whammy of hospitals maybe cutting back because they're losing revenue because the state's cutting back, and people becoming uninsured because they've lost their job. And so they become the uninsured when they get sick. So the double impact there. So the rural areas in particular, there's a $50 billion fund that was put in the bill to get the votes of some members. Unclear how that's going to be distributed. The formula is still being developed. So stay tuned to that. You can go to, let's see, the next slide is on the taxes, and we talked a little bit about the taxes here on the CTC. There's also a new two other things that Daniel didn't mention. There is the adoption tax credit's been on the books, but it's made refundable up to $5,000. So for families that adopt, especially lower income families who adopt children with special needs, which is a big part of the population, there is the benefit of a $5,000 refundable tax credit to offset the costs of that adoption. And then there's what's called in the bill, the Trump accounts, where if you have a newborn born between the years of 2025 through 2028, you will receive $1,000 in an account. And the presumption there, and actually Senator Booker has been an advocate of something like this, but I think the long-term goal is that you would build on this. And so we'll see if anything becomes of that, especially under the certain circumstances it was passed. So if you go to the next slide, you'll see some of the data in terms of New Jersey. These are based on the Center on Budget and policy priorities, they've done and they continue to do some calculations for each state. So if you can, if you get a copy of the PowerPoint, Katie has put in a link so you can see more detail on that. But about 324,000 New Jerseyans will lose health insurance coverage and become uninsured under those kind of circumstances I mentioned, just on Medicaid and the Affordable Care Act. And again, you have the food stamp potential cuts could force between 96 million and 287 million in new costs on the state. Again, according to their calculations, up to 75,000 citizens of New Jersey will be at risk of losing some food assistance. There are, various changes in the Medicaid program or into the food stamp program, SNAP program, in terms of things like calculating or how you calculate utilities. Less positive. It'll cut benefits to a certain extent to a lot of people. So you can go to the next slide. Again, the center projections in terms of Medicaid and SNAP cuts, loss of 34,000 jobs in New Jersey, potentially. Again, people don't tend to think of these cuts. They think of it from the people who are getting the services, but obviously if you're cutting back your budgets, you're also eliminating jobs. And then other things, the student loans that Daniel mentioned. So there will be those increases. Again, this is all the center and budget and their calculations. Let's see. We can go to the next slide here. In terms of the White House, we talked a little bit about this. Stepping back a little bit on the budget process. So what's supposed to happen under the budget process? And Danielle touched on some of this, but under the Budget Act of law, the president is supposed to submit a budget to Congress the first week of February. Now, this is the first year of a new administration, so they usually do delay that. But under the Budget Act, it's the first week of February. Then Congress is directed to create a budget resolution in April. And actually, under the Budget Act, the House of Representatives is supposed to pass all 12 of their bills by July 1st. That hasn't happened. When that, at the same time, the Senate's supposed to receive those bills or start to do their own bills, and then they negotiate. And so there should be a number of bills that have been passed based on reaction to the president's budget. So the president's what they call skinny budget that came out in the summer didn't have all the details and all the volumes that go to Congress that can help them explain or decide. But you see there some of the initial proposals in the president's budget, Head Start flat funded, cuts of $31 billion overall in the HHS budget, which covers most of the programs that we're most concerned with. Eliminates the LIHEAP program, the low income heating and energy assistance programs, becoming even more vital because originally that was a cold weather program. And then obviously over the last several years, it's become more vital in terms of summer cooling. They call for numerous block grants within the Department of Education, including IDEA, 21st Century Learning Centers. There had been a controversy there in terms of the administration withholding this year's funding. They're proposing to eliminate that, and the McKinney-Vento homeless students program will roll it all into one block grant. So if you go to the next slide. Again, continuing severe reductions in terms of the Supplemental Nutrition Program, WIC program. There are $1 billion in cuts to SAMHSA. Most of these under the administration's proposals combines and eliminates. Also cuts to rental assistance and even cuts to the what we call the CB cap, community-based child abuse prevention program, which is part of CAPTA, and a 10% reduction in promoting safe and stable families. If you go to the next slide, So I mentioned the 12 bills. And Danielle had mentioned how the House and Senate have not agreed to top lines. Usually what's supposed to happen with a budget resolution, you get your instruction if you want to do a reconciliation, which is what this bill was, the Reconciliation Act. But it's also supposed to set agreeable spending allocations for those 12 bills, that the Senate and the House will agree to that jointly. They'll each take a crack at how they want to spend those dollars, and then they'll negotiate. Well, they don't even have a top line. So we're operating at potentially two and likely two very different appropriations levels. The House the House committees have passed 9 bills. Remember, I said the House of Representatives was supposed to pass all 12 bills by July 1st. So what you have is a subcommittee acting, and we always look at the Labor HHS Education Subcommittee is one of the key ones we look at. You have 12 of those subcommittees. Those bills then go to the full committee. The full committee then sends it to the House floor where it's all thoroughly debated. That's not happening here. So you can see there the House has passed only 2 bills, even though they're mandated by law to pass all 12. And so that adds to the problem. Now, the Senate committee has passed 8 bills, which is a little better, but still behind. So you can go to the next slide. The Senate so far has been rejecting those proposed cuts that I had just mentioned. So your senators will be key, obviously, in seeing what happens here. They do need to have 60 votes to pass the bill. So under the reconciliation, part of the rules of a reconciliation is you only need 50 votes, which is why they use it so frequently. But on these bills, you need 60 votes. There were in the Senate bills so far slight increases for childcare and Head Start. The full funding for mental health and substance abuse block grants, so rejecting those cuts the administration had proposed, and rejected the elimination of things like LIHEAP and the community services block grant. Also rejecting the block grant of the education programs and full funding for WIC and CB cap. So that's in the Senate bill. We don't know where the House is going to be. Next slide. So some bills have been passed. The juvenile justice housing bills, there are some cuts there. Again, they haven't released the labor HHS bill. So it is, in recent years, they have sometimes not done that on the House side because they don't want their members to have to take a vote on it. But it makes it even more difficult to have these negotiations with the Senate because you don't know what the House is saying they can support, they can pass, while the Senate has been a little clearer. So we have, more reason for a real challenge here in September. Remember, and I don't think any of us mentioned it here, the fiscal year ends September 30th. So when they come back after Labor Day, in theory, they have only a few weeks to get all this done. So the continuing resolution that Danielle mentioned is basically, it depends how they write it, but it will continue usually funding at the current level. And generally when they get to and usually you don't have a full government continuing resolution. We seem to be getting more of those of late the last few years. What you would usually have done, you would have passed maybe say 7, 8, 9 of the 12 bills. And then for the remaining ones, maybe you do a continuing resolution. That resolution maybe goes a month, give them more time to negotiate, or 2 months. What happened last year was because of the election, they basically, and you may remember this, they punted until the old Congress punted with a continuing resolution that flat funded everything at 2024 levels. And they extended till March. And as you recall, there was the controversy in March about whether or not the Democrats should have blocked it, but they let it go, concerned about what the administration would do without any kind of instruction. So we're in even more of a challenging circumstance. The president has sent mixed signals in terms of negotiating with the leaders of Congress. Senator Schumer and Congressman Jeffries, who is the Democratic leader on the House side, have sent a letter to the Republican leaders in the Senate and in the House, and the Speaker and the Majority Leader, saying, let's sit down and talk. They haven't gotten a response to that. So again, something, obviously, we're going to have, well, I can't say obviously. We may have a continuing resolution at some point, but does that happen before there is a government shutdown? It's unclear. And it's unclear, you know, how this gets certainly fixed in the long term. But in terms of after September 30th, it is very unclear what is going to take place here. This is also, I think Danielle mentioned some of this, the sequestration and the impoundment of acts of funds by the administration, refusing to spend some money. The challenge there for some members of Congress is they're saying, if we do a negotiation and we agree to these funding levels and the president passes it or signs it, is he going to come back 2 months, 3 months from now and do these same kind of impoundments and refuse to spend some of this funding? You know, the Constitution empowers the Congress, particularly the House, to control the purse strings. So this is going to be a real challenge in the next several weeks after Labor Day. So hang on to that. With that, I guess we can do questions. You have a next slide that I think has some contact information. Again, if you get PowerPoint, you can do some of these things. Sign up to the action alert. The CWA Connect calls we do every Tuesday at 1 o'clock. You usually invite in one or two guests to focus on some of these issues. We're doing one this Tuesday on the tax pieces of this budget bill. But also the action alerts will be very, I think, important because, as I say, there's going to be a lot of activity here when they come back from the summer break. And September and October are going to be particularly challenging. With that, I think we're open for questions, I guess.
Yes, I think we are open for questions. Thank you, John. That was really helpful. I just wanted to add a couple of things. And I know you've talked about getting the word out. Danielle talked about getting the word out. And I just want to remind people that even though all of us appreciate that Medicaid funds New Jersey family care, a lot of people in New Jersey don't really understand that New Jersey family care is our public health insurance system, is funded by Medicaid dollars and CHIP dollars, the Children's Health Insurance Program, and that 20% of New Jersey residents get their insurance through New Jersey Family Care. And so people will say, I'm not on Medicaid, I'm on New Jersey Family Care. And so as we're talking to our neighbors and our colleagues and other people that we know, please try to make the connection that Medicaid in New Jersey is New Jersey Family Care, right? And the focus of some of these cuts are really on the people who are the working age. And there's about 550,000 of them in New Jersey Family Care that are going to have to comply with this work requirement. And that's where we're going to need assistance from the community-based organizations, the faith-based organizations, to make sure that people really do understand what's at stake and what people need to do to remain in compliance, both with family care and also with SNAP. Right. So I think in the past, where there was economic hardship in a community, the state was able to waive the work requirement, but that's no longer the case. That's my understanding. John, I'm going to look you to nod that the state doesn't have that luxury anymore or that ability. And so people need to understand what the change means and that they do have that work requirement and it is going to matter. But I really do appreciate all the comments in terms of the unintended consequences, right, of all these cuts and how it could filter down to the schools. There's about 90,000 students in New Jersey that currently receive health and behavioral health services that are Medicaid funded or funded through New Jersey Family Care in school. And some of those programs are at risk, as is probably, Commissioner, I'll look at you in terms of the children's system of care, right? Unintended consequences as all of this rolls out, it could harm that program, which I always say is sort of built on a Medicaid platform, right? But, you know, families are supported, and that's something that we do for everybody in the state, regardless of income, and has been very successful in terms of addressing the needs of children who have emotional behavioral problems. So I just want to make those connections for people, that as you're talking, and I saw in the chat, which is great, people want to join the advocacy. It's really trying to make it very concrete for people as to who is impacted by these changes.
Yeah, and I guess I would just add to that too on the Affordable Care Act, because
Right.
insurers will be sending out their notices by at least November. They're a lot worried. They want to tell people that the credits may be going away. And so people need to understand a lot of that. And that could actually be saved before the end of the tax year. And so, but when they see big increases in their insurance premiums, if they're through the exchanges, the Affordable Care Act, this is having an impact on them. They need to understand this budget bill had an impact on that.
Okay.
The other thing that I just wanted to add is, John, in the early part of your slides, you were talking about the impacts of New Jersey on other cuts outside of child welfare, or, you know, protective services, or in the Medicaid cuts. Even if it's not a direct cut to the Department of Children and Families, if there are cuts in other parts of the state, you know, federal budget to the state, then that forces the state to have to consider how it spends its dollars, right? If the resources shrink, then how do they get distributed amongst all of the state departments? So even if there's not a direct correlation to a federal cut to DCF or a federal cut to DHS, that doesn't mean that the state won't have to make difficult choices, or the new governor won't have to make difficult choices about what to fund or not. So we're not completely out of the woods on some of this.
Right, right. And I think that's the point we were trying to make in Congress, or Katie was making, you know, because if you want to do prevention, well, what is prevention? It's access to mental health services, substance abuse, housing services, all these other things that are getting cut.
Okay, so let's see what we have. Fee for service services, are they considered federally funded?
So some of the fee-for-service programs in New Jersey, like our intensive and community, our IICs, they are Medicaid funded. And so many of our fee-for-service programs do receive Medicaid funding, or are funded through Title IV-E, which is, you know, foster care dollars that come to New Jersey. And so it's what Karen described earlier in looking at your contract. The fee-for-service contracts also would include whether or not they receive federal funding. So, like, yes, you need to pay attention to it, because yes, fee-for-service, much of it is also federal funding.
How would the work requirement apply for people who are undocumented and don't have a work permit?
Well, some of the undocumented people are getting cut off of these benefits. So, I mean, it's you know, they're already addressing them in terms of that way. In terms of a lot of these restrictions are tied to immigration status, the child care tax credit, if has certain requirements for the parent to have a social security number. So some kids will get knocked off that way. But also the work requirements, and some of these, like food stamps and Medicaid, they'll get knocked off anyways, because they will become ineligible.
Okay. So
yeah, and I think, I'm sorry, I just wanted to add, I do think it's important to note also that undocumented individuals were never eligible to receive federal benefits, but in New Jersey, we do have, like, the Medicaid lookalike, you said family care, Mary. And so the state actually has been paying for undocumented citizens, you know, in New Jersey to be able to receive those services. So that's another place where, right now that's continuing, but as the dollars shrink and the state has to determine whether or not it can continue to fund some of those Medicaid lookalike or some of those other services that the federal government has never supported. The feds are making it harder now for the states to be able to continue to provide those services.
Right. And I was going to mention about the fact that all the children, there's probably about 45,000 children who would be eligible for family care except for their immigration status, they are enrolled in New Jersey family care and paid for by state funds and therefore get regular health care.
Yeah, and I should mention on that too, for states like New Jersey, there was some attempt or consideration of penalizing states who were stepping in to fill in those gaps by, maybe cutting funding through Medicaid. So they didn't make it into this bill, but there are people out there. We'll have to pay attention to any kind of future legislation where they would attempt to come after states who are filling those gaps for immigrant families.
Is Gateway included in the withholding funds conversion? Sure, I totally understand that question.
Yeah, I was going to say maybe if the person could expand on the question, that would be helpful.
Okay,
I'm
so
thinking yeah.
all right. John, did you have a thought?
No, I know.
Okay.
The only gateway I know is the information source of the HHS.
I think it's a provider agency in New
Okay.
Jersey. That's why I'm
I think
seeing
it is the provider agency.
Okay.
Yes, so the person who put that question in, if they could fill that out. The next question, will any developments in the foreseeable future, could it lead, it says, to the reinstatement of the child care programs that help parents with child care, such as programs for parents or the CCC? So I think there might be a little confusion about this, and I will just provide a clarification, which I hope helps. So the child care program right now that's been closed is the child care assistance, the subsidy program, right? And so that program, the child care assistance program, provides a subsidy for low income working parents so that they can have child care and continue to go to work. And there are about 70,000 children who receive that subsidy currently. As of August 1st, because of a New Jersey state budget shortfall, they stopped taking applications. My understanding, and Commissioner, you can correct me if I'm wrong, but any child coming into foster care would still be eligible for the subsidy, as would anybody who's a TANF recipient, right? But everybody else. So in this funds both child care, after school programs, and summer programs. So for example, if I have a child who's currently getting a subsidy and I'm pregnant, my child that is born to me 3 months from now could not get a subsidy program because they're not taking new applications. And so there is some work being done, which I had a slide which we'll show at the end if people are interested in learning more about that, but it is because of a state budget shortfall. Now, the child care resource and referral agencies, which were mentioned like programs for parents, it's my understanding that some of their funding comes from federal dollars. And again, I'm going to look at Commissioner Byer. I believe that's the case. So some of the programs that got listed as potentially not being fully funded in the next budget, and John, you might know more about this, that could impact the funding of the child care resource and referral agencies, which are county-based, and that's where I would go to find child care.
Yeah, and I think some of that is a set aside over the big block grant, the child care. So yeah, it depends on what appropriations decisions are made.
All right. Are there changes for requirements for parents of children under age 14?
One, I think, no, I don't think under 14. I think where it was changed is, I think it was food stamps that was under children under the age of 18, and they've changed that to under the age of 14. So I don't think they've changed beyond that, but it's the other population, the little older population that's been.
Okay.
It ultimately means those families will get less, right? So if you have 3 kids and 1 or 2 are over that age, your benefit will be reduced, which affects the younger kids. So
yeah, so indirectly it
Yeah.
does. Yeah. All right. Can you speak to how federal cuts might possibly affect state plans for expanding preschool? And my sense is those are state dollars as well, the expansion of preschool. And so the potential impact again is as the state might have to adjust its budget to cover other programs because of federal funding cuts, right? So again, that sort of rippling effect or cascading effect, things could get impacted, right?
Yeah.
Then somebody talked about, John, what you already mentioned about the federal government financially penalizing states for paying for some traditional services. And that provision did not make the bill. I think it was going to reduce the Medicaid expansion population reimbursement from 90% to 80%. So that still is at 90%.
Yeah.
Does DCF anticipate cuts to IIC services or family support services for children with IDD?
No, not at this time. We're not planning on any of that.
Okay. So are we going to see an increase funds to hospitals on charity care to absorb the administrative cuts? Well, that's an interesting one that I don't know, Commissioner, you or I want to answer. I think people need to talk to their legislators about that. And again, this is the point, I think, of what our presenters have been saying. Everything is happening. There's pieces of it that they're not finalized, but everybody on this call has a voice. And it's really up to you to reach out to your respective legislators to make sure they understand if you're upset, what you're upset about, or if you're going to be impacted by any of this, how you see yourself being impacted so that they really do understand that people care and what they care about.
Right.
Okay, so undocumented parents with U.S. citizenship children, would those children have access to SNAP or New Jersey Family Care? So I know those children can still enroll in New Jersey Family Care, although parents might hesitate.
Yeah.
John, I'm not sure if you can answer the SNAP part.
Yeah, I think it's the same situation, basically.
Okay. All right. So the person in Gateway, they were talking, it's the Head Start program. So I think there's some uncertainty about Head Start funding. I'm gonna say.
Yeah, I mean it kind of indicated they were going after it. Originally, there were some problems in terms of Head Start programs getting funding. There was the shutdown of the system. So far they've left it alone. So I would think, the Senate has a slight increase. I think I mentioned in the president's budget, they left it alone. So we'll see what happens.
Okay. And then just to clarify, I was probably speaking too fast. The child care subsidy program will still be available to families who are on TANF, temporary assistance to needy families. Okay, so, all right, the last question is from a director of a child care center that serves low-income families. The cuts to the child care vouchers leave many children out of government sight, forcing families to seek out housing, including unregulated homes. Is there something that DCF can do to protect children in unregulated homes from abuse or health problems in contaminated areas or overcapacity? And I don't know that licensing for housing comes under DCF, but I will look to you, Commissioner, for confirmation.
Yeah, it doesn't, but I was reading the question also, Mary, and I was wondering if the housing was about, it seemed to me that the question was about, will people be forced to then seek unregulated childcare, which could be in, different parts of, in people's homes, if then they can't get a subsidy. And what will DCF do? So DCF does license family care as well. And we will continue to try and make family care, family home-based care easy for people to be able to obtain that license. And, there are requirements for in home-based childcare the staff to or parent to child ratio. So, we rely at DCF on community members, on individuals, to be able to share information with us when they find that there is a concerning home or someone's providing childcare to too many children in their home, so that we can go out and then try and work with that family to become a licensed center. But we can only do something when we know about a situation.
Okay. So, and Commissioner, it looks like the last two questions are about the money you mentioned at the beginning, the rollover of funds for mental health. And is there a spending plan or?
So that money originally was put in by the state legislature in the FY25 budget. Only 1 million of the $30 million had been spent, and that went to the Healthcare Quality Institute to do a statewide assessment of mental health services for youth. So beyond the children's system of care, it's kind of looking at prevention all the way to hospitalization for children with behavioral health or mental health needs. And so my understanding is that once that report is complete, which, we hope will be by the end of December of this year, that then there will be recommendations that come out of that assessment, that the $29 million would then be used to implement those recommendations.
All right. So I don't know, John, if you had any other further comments. Otherwise, I was just going to talk a little bit about childcare and put in our.
No, I'm good. I've said all I can.
Okay. So I don't know, can I get that last AC&J slide? Or the only AC&J slide? So, all right, just so people know, I think most people on this call are aware of Advocates for Children of New Jersey, but we are a multi-issue child advocacy organization. Our mission is to promote and advocate for programs and policies that we think will provide every child with an equitable opportunity to grow up safe, healthy, and educated. One of the main areas we are focused on is early learning, specifically childcare. And so as has been mentioned, the child care subsidy program, the applications have been stopped because of a state budget shortfall. I do think people are already starting to feel that impact, and the co-pays that parents pay are also going up to 6%. So we do have a petition on our website. You can find it clicking through on this slide. We are trying to encourage people to raise their voices around this issue to try to get that funding put into the budget. And then the other thing I just wanted to mention is that there are several organizations, including the Rutgers. All right, so it's the Rutgers Center for Women and Work. I'm sorry, I want to do the acronym. The Rutgers Center for Women and Work, which is headed by Deborah Lancaster. The NJC, which is the child care organization, and they are sort of the trade association for the providers. AC&J, and also some of our early learning funders, the Burke Foundation, Terrell Fund, Schumann Fund, the Marr Foundation, and the Tao Foundation, and I think the Dodge Foundation, that have formed a partnership also with New Jersey Citizen Action and some other folks to form a coalition, the First 1,000 Days Coalition. And the goal is to really make sure that we have a strong childcare sector that is adequately funded, and that if we advocate together, we can advance policies that will strengthen the childcare system, strengthen our workforce, and that we will have stable childcare that is accessible and affordable to all people that need it. And the icon is also on this slide, and you can click through and get more information about that as well. So I don't have anything further except to say thank you all for joining us. I really want to stress that there is an opportunity to make sure that people are informed. You can get a lot of information from state organizations, national organizations around all these changes to Medicaid, which, as I said, funds New Jersey Family Care, SNAP. It's really important for people to stay informed, but also for people to express their opinions. Your voice does matter, and I just want to encourage everybody to do whatever you can to advocate, but also to educate those people around you about the changes and the potential impact. And if you don't understand something, please reach out to people at ACNJ, to people at DCF. We're happy to provide any information people need. I don't see. Are there any more questions? Oh,
I think the only questions, Mary, were related to the childcare subsidy
okay.
program. And I just wanted to make sure that everybody on the call understands that the subsidy program is not a DCF program. It's a Department of Human Service program. And so there was a couple questions that really are not questions that any of us can answer, about whether it would be reopened or whether they'll maintain a list of individuals who are seeking subsidy. So that would be the Department of Human Services.
Okay. And people can also contact ACNJ. And I'm sorry I didn't say that. It is not a DCF program. It is funded by the Department of Human Services and the New Jersey Legislature. So, all right.
Thank you. Thanks everyone for participating. Thanks,
Thank
Mary.
you. All right. Thank you, Commissioner.